What is the definition of a good doctor? Nice to meet you again.
Nice to meet you as always.
It's been a while since I saw you from in Germany, right?
Yeah. Right before the corona pandemic. Yeah, exactly right before it, yeah.
All right. Could you please introduce yourself?
My name is Ahmed Ragheb. I am assistant professor of urology based in Egypt.
Tell me, where do you practice and then characteristics of your city? Because I don't know about Cairo. I haven't been to Egypt neither. So I'm very curious about your city.
Well, I practice in Cairo, as you mentioned. Cairo is the capital of Egypt. One of maybe the most crowded city in Egypt. We have a population, well, in total Egypt we're above 100 million now, but in Cairo per se it's above 20 million.
20 million?
20 million, yeah.
Boy, that's a lot. It's a huge city.
It's a huge city where you have the best hospitals, the best neighborhoods.
And best traffic?
And the best traffic, yeah, and the best traffic. It's crazy out there, but like we call it, it's organized chaos in Egypt. Yeah, and actually Cairo is one of the top maybe hubs for medical tourism because we have patients from all over the region, from North Africa, from the Middle East.
So geographically, Cairo is located right in the middle.
Right in the center. Yes, correct. So you could come to Cairo, get the proper treatment you deserve and need, and at the same time you get to visit one of the wonders of the world.
I see. So the pyramids and the other legacies are near around Cairo?
Yes, because the pyramids and Sphinx are in Giza, and Giza is considered a city within the zone of Greater Cairo.
Is that so? So quite near around. It must be a great place for the medical tourism then.
Yeah, we have the finest hotels as well.
So patients from Africa, patients from Middle East?
From Middle East, from Saudi Arabia, from the Emirates, from Kuwait, Iraq.
I didn't know about that.
We have a large audience, not just Egyptian patients.
Okay, so you are seeing many international patients as well.
Correct, because like I said, Egypt was well known a long time ago. My education, my university education was in Cairo University, at Qasr al-Aini Faculty of Medicine, which is considered the most prestigious and oldest school of medicine among the region, the whole region. That's why, this is where the reputation comes from.
Where were you born?
I was born in Egypt. I was born in Egypt, and right after I was born, I moved to the States with my family because my father was preparing his PhD in the US, and that's where I spent the first, let's say, 9 to 10 years of my life.
That's why you speak such a good English.
I try to.
So, after that, you went back to Egypt then?
Yeah. I spent my elementary school years, I was in Anastasia Elementary School in Long Branch, New Jersey, where I was fortunate to be in the gifted class over there, and I even graduated as a valedictorian.
Wow.
And I remember at the time I was the one that gave the valedictorian speech to the mayor at the time.
Oh boy.
Yeah, and then we went back to Egypt when my father finished his mission, and I entered the Misr language schools, which was one of the renowned language schools at the time, and we had the best teachers whom I'm grateful for.
You had your elementary school in US and went back to Egypt and studied afterwards?
For middle and high school, correct, and university.
So you must be called as a gifted child. So you were good at scores since early days, right?
Yeah.
How do you, choose your university when you're in high school?
I was passionate about science ever since I was in school. Whenever were to be asked, what would you want to be, I would say a scientist. But then moving on through the end of our years, I became deviated towards biology, and that's when I wished to be a doctor at the time. And to be a doctor in Egypt, you have to be top of your class.
Sure.
Because, the top schools in Egypt, it's first medicine, then engineering afterwards.
Well, same everywhere, I guess. It must have been quite a tough, work then. So, do you have to attend the college, like 4 years, and then go to the med school?
No, it's a different system back in Egypt. You take the whole 6 years of medicine school. It's almost 6 to 7, and then there's 1 year of internship where you get to, round at the different departments to learn and to decide which specialty you want to go with at the end.
So your system is just like mine. South Korea has the same system. We don't have to attend the college. We just go to a medical university, School of Medicine, for 6 years, and then internship and residencies. That's how we...
Exactly.
So you went to the med school, and then you may have had the internship, right?
Yeah.
At what point you wanted to be a urologist?
At what point? I think that that decision was during my internship year. I get to, like I said, you get to round, and that's actually when I found myself fond of the subspecialty of andrology. And as you might know, in Egypt we have a designated department of andrology other than urology. I think I took it the hard way because I was fond of andrology. I found that andrology was more matching my personality. It has this nice combination or blend of surgery and dealing with the psychological part of medicine. So that's what I found with andrology. But at the end, I chose urology because I thought since I want to be a good andrologist, it's better to go through urology, to have a more in-depth and better understanding of the genital system. I thought that would make me a better andrologist.
So there is a little difference in my system then. We usually have to be, there's no andrology specialties. Andrology is a kind of subspecialty of urology in my country. But in Egypt, it's different, right? Andrology, urology.
Correct. That's specifically if you require university, yeah.
So getting to urology is more difficult than the andrology, I guess.
Yeah, it takes higher grades.
So many people doesn't know what it is for the med school students to choose a job among the many specialties, right? First, you have to decide whether you are going to see a patient in actual person or not. If you are going to decide you are not going to see a patient, then you can become a radiologist or, pathologist, specialties like that.
Correct.
But after, let's say, you decided to see a patient, then you have to decide whether to do a surgery or not. Why are you interested in seeing a patient and then doing a surgery on them? Why?
Because, of course, the two largest branches of medicine, either internal medicine or becoming a surgery.
Correct.
But when you have a hobby of handcrafting, I think a surgery will fit you better. And as surgeons, I know that we have the technical part more than the medical part, but at the same time, it's like I said, it's a good blend of both.
Without a brain, you are just a technician. But medicine doesn't work. Medicine do not work that way. What I have seen so far, Ahmed, traveling several countries, is that still there's a strong social stigma. They try to ostracize those who try to do sexual medicine. Even so, why did you want to be an andrologist?
Well, it started, like I said, the combination of surgery and mental health, and that was my second favorite subject in medicine school. And at the same time, I realized there is an increase of awareness nowadays among men, among couples. They're now seeking more treatment, and I think that it's a very fertile subspecialty. You're seeing innovations day after day. So yeah, that's why I said I must go for it.
Because as you know, many urologists are going after the robotic surgery, like a robotic prostatectomy. The fancy robot surgeries out there. Actually, it will generate more revenue for the most of them as well. But even so, it may not be more lucrative than the robotics. It may not be more look better, because oncologists always look better than the andrologists. Most of the patients or the doctors regard it that way. But even so, you wanted that uphill battle. Wasn't there any remorse about your choice?
No, I'll tell you what. With andrology, it's a totally different story opposed to oncologists. Of course, oncologists are the best surgeons. I admit that. But at the same time, in andrology, you're not actually treating a life or death issue. It's not a disease. let's say it's quality of life medicine. You're improving lives. You're making people happier. You're making couples happier. So you get to not even treat one person, you treat two at a time. So you're making them happier either by restoring their intimacy or making them happier by having the ability to have a baby. So that was the most appealing part of it.
I mean, there's still a curiosity arisen. So you went to Dr. Daniel Osmanov in Kiel to get a fellowship. I heard that it was a grant from the
ESSM.
ESSM, right? It's a great grant. And I heard that it's really hard to achieve that. Congratulations.
Thank you.
But even so, you had to give up making money for the good portion of your life. Even though you are married, you had a child, you risk yourself to go for a further study, to study more into the prosthetics, subspecialty where not many people know about it. How it happened?
Well, I always get that question. I mean, how come, Ahmed, you're traveling all this way and stopping your practice for, let's say, almost over 3 months? The answer is simple. There's always room for improvement. And when you're used to being best at what you do, or you strive to be best at what you do, where else would you look for this kind of expertise and knowledge and learning except at the best places? And with Professor Osmanov, the Kiel School of Urology, that was one of my top priorities because it was one of the highly recognized, or the top 5 centers of excellence across Europe. We have an famous Arabic saying that says that all vessels in life reach capacity upon filling, except the vessel of knowledge. The more you fill it, the more it expands. So learning never stops. And like my friend Faisal Yafi once said, you stop learning when you die.
I think that's quite true for the doctors. But even so how many years in Egypt do you have to spend to be a urologist?
Yeah, it's a long journey. First of all, you go through your residency. At my time, it was only for 3 to 4 years. Nowadays, it's 5 years. And then you prepare your master's degree, because we have, it's not one board degree. We have 2 degrees.
Oh.
First, your master's degree with a comprehensive exam, and you do your thesis at the time. And my thesis was, of course, concerning andrology. Mm-hmm. And then afterwards, in a 2 to 5 years' time, you go through your PhD part and the doctorate degree. That's another comprehensive exam. And then you could call yourself a consultant, or in my case, since I'm an academic, a lecturer or assistant professor.
In total, it takes you about
maybe 10 years after school, at least.
Including school, then it becomes 16 years.
17 years.
17 years.
That's a long way.
But to be honest with you, usually many doctors who spend 17 years of their life dedicated just to study this field, I mean, many of them just give up. They think that I'm fed up with the study. I think I know everything. They stop learning. Usually, they stay that way. I'm not judging. I think they are doing a great job with their own surgeries, but you didn't. Why? You wanted to excel then?
No, I'm trying my best to be good at what I do. You must always remember that you take the responsibility of patients or people's, let's say, future and happiness, and they trust you blindly. So it's a big responsibility. So you have to always be up to date, provide the best service ever. Mm-hmm. And like I said, it's a continuous process. You never stop learning, and you want to always refine to provide the best service. It's our responsibility that we chose from the beginning.